Wait, I'll still make sure in a second. Usually takes a few seconds.
No problem.
Okay, yes, it has started. So I think we can start.
Great.
Assalamu alaikum and a good evening to all of our viewers. Today I'm Raisa and I have brought out the third and the final episode for EiFAC, Exchanging Ideas for a Change. And today we have a very special guest from all the way from the US, from Massachusetts Institute of Technology, MIT Sloan. And we have Miss Mahreen Khan, who is a Ph.D. candidate at MIT Sloan, and she's doing a joint research with another professor from Yale University. And on her basic research focuses on labor market issues that impacts developing countries within the COVID-19. So, Ms. Mahreen, how are you?
I'm doing as good as I guess we can be all doing during this time. Thank you so much for having me here. I know you were hoping to have Dr. Mobarak here with you today. Unfortunately, he has had some conflicts, which is unfortunate for him, but fortunately for me, I get to be here with you to talk a little bit about the work that we've been doing and also connect with the youth in Bangladesh who are very much at the forefront of how this will be affecting our economy.
Well, it's an honor to have you. And so I think before I start with any sort of discussion, I'd like to know how the situation is from where you live right now. How is COVID-19 affecting you or people around you?
Well, I mean, I think for people who have been following the news about the US, the response here has been very slow. The response is also very disaggregated. So the United States, as you know, is composed of states, and each state has a lot of independence in how they enforce different measures. The US does have a very strong emphasis on personal freedom, which does make it difficult, I think, or challenging for policymakers to enforce strict measures such as quarantining and isolating. So I think in that regard, flattening of the curve has been taking a significant period of time. I think in Boston specifically, I think we're lucky to be here with, you know, we were trying to take measures early, but so we're told to wear masks outside. So you see most people wearing masks. Most of the universities stopped classes around early March and went completely online. So I think many of the audience in this platform right now is maybe able to relate to some of that experience. So currently we're doing all classes at MIT and in fact almost all universities in the US online through Zoom, which is an interesting experience. There are pluses and minuses, but I think we all agree that not having that face-to-face interaction does take away some of the experience of learning, which I think we all understand.
Actually, I think, yeah, I mean, in Dhaka as well, I think most of our classes of university is being happening online, and it, as you said, does take away the experience of learning, face-to-face. So, as in my introduction, I talked about the research that you're doing, so like a joint research. So, could you tell me a bit about what your team is working on about that research and, what's the most imminent issue in Bangladesh as of right now, you think?
Right, thank you. I think I'll just start on a small positive note. I think while there's been a lot of negative consequences economically and public health-wise, of course, of this crisis, I think one of the positives has been that it has really brought together a lot of researchers and policymakers, people who are genuinely interested from around the globe, a lot of us Bangladeshis who live in different places. And now we're all able to come together and connect on work. And I think, being working from home and being more available has made it easier for us to work across different time zones. So just to give you an example, the team I'm working with, which is led by Dr. Mushfiq Mobarak, who's at Yale in Connecticut. There is Rashad Hassan, who is a professor in Melbourne. There's Dr. Ghazi Hassan, who's in Bangladesh, Dr. Abushan Choi, who's in Florida, and myself and here in Boston. And also the works has felt almost seamless despite all our spatial distances. So that's the positive note. And I think everyone is genuinely interested in trying to figure out how we can each in our own way using our research capabilities to help Bangladesh. So I think that has been kind of at the forefront. So with that, I think I'll start with kind of what motivated us a little bit and how we got to the research question that we are looking at. So just as of today, we see there are a little over 7,000 official cases in Bangladesh in COVID. Obviously, everyone suspects the actual number to be much higher than that. And then if you look at the deaths and the recoveries, right now the deaths outnumber the recoveries, which I think is a particularly telling statistic for a country like Bangladesh, because I think it reveals some of vulnerabilities. So, which one of it is relating to our capacity from our health and health facilities capacity and just overall resource limitations. So our next door neighbor, India, has 0.5 beds per thousand of the population. Just to give you some reference point, China, which has been able to contain the virus, has 4 per thousand. In Bangladesh, obviously, the situation is much worse. Looking just at the number of beds across districts, we found that it's roughly between 0.2 and 0.5 beds per thousand. And that's not even really accounting for other limitations like actual resource ICU capabilities, lack of ventilators, and even PPE and all of these limitations. On top of that, we also know that testing capacity is also severely limited. So while we have tested about 5,000 people as of yesterday, I think, which is significantly up in the last 2 weeks. However, if you compare it to countries that have been testing a lot, so Italy, for example, which has the highest number of per capita tests, so they did like 21,000 tests per million of the population, the US and South Korea. South Korea has also done really well in terms of testing, so they're at about 10,000. So Bangladesh still has a long, long way to go. And just earlier, we were discussing about the limitations in testing kits, availability of testing kits are, so that still continues to be a big problem. So what that really means is that we can't really rely on having mass testing capacity increased in the coming days and weeks in order to address this crisis. So when there is this limitation in data around testing and knowing actually which cases, where the cases are, what we as researchers can do is try to find alternative ways of understanding which parts of the country are more susceptible at risk of COVID. I mean, from an economic perspective, we know that our 2 major sectors are R&G with over 85% of our export earnings. We all severely impacted. $3 billion of orders have been canceled. So we know there's a large population there that's being severely impacted. And then our next biggest export source of earnings is remittance earnings from migrants. And we all know that they're another at-risk population for multiple reasons. So one is, of course, the remittance factor. So a lot of the countries where our migrant workers have themselves experienced either high exposure to COVID or have had lockdowns, which have led to a lot of them having to return or being repatriated back to Bangladesh. So like around mid-March, we saw that a large population of Bangladeshis were sent back from Italy or came back from Italy. And then even as recently as yesterday, we had migrants being sent back from Kuwait. So this actually brings together two risk factors. So one is actually in the risk of spreading COVID itself. So I think we realized that the COVID transmission process happens through human to human interaction, and so one of the most significant ways that we have actually COVID has really entered into Bangladesh is through migrants who have ended up returning to Bangladesh. So I think we saw reports around how migrants who came back from Italy who were asked to quarantine didn't end up quarantining properly, and not even to their fault necessarily, because we just don't have the ability to quarantine appropriately in Bangladesh, and then ended up being tested positive in Ghazipur and in other parts of Dhaka and so on. So what that indicates to us is that this is possibly one of the major ways in which COVID is entering into Bangladesh. So migrants who are coming back and going back to their home districts or home upazilas or villages, they're carrying with them the disease and potentially being a source of transmitting that disease in the community afterwards. So that's one risk factor that comes from the migrants. And the second risk factor is, of course, as I mentioned before, is the economic risk. So when these migrants are coming back, they're no longer able to support their families and their communities through their remittances as they had been able to in the past. And so this poses a secondary risk to these communities because of from an economic perspective. So what, given that we realized this, the researchers in our team thought that one way to approach the problem of how COVID is spreading in Bangladesh and potentially identifying the areas of Bangladesh which will be at higher risk than others, and identifying these areas would be through these migration. And the reason to identify high-risk areas, as I mentioned before, is we do have very limited resources from a medical perspective, be it from a health or an economic perspective, or even from the perspective of, whether if we want to do information campaigns or other interventions, we need to target areas in a given order, and we may want to prioritize areas that are more at risk first compared to other areas. So, for example, we know that potentially some of the hill tracts are, one way to distinguish this, for example, would be, we know that areas like Kumilla, Ghazipur, Norshindi, they have a large number of migrants coming back from areas that could have had an exposure to COVID, like Singapore or Italy, and the upazilas in those districts may be at higher risk than, for example, areas like Bandarban or Rangamati and Chittagong, which have much fewer number of migrants in general, and then much fewer migrants to these high-risk countries. So using this approach and this methodology, we developed an exposure index, which takes into account all these factors that I just mentioned. So number of migrants from each of these areas, and then the level of the destinations to which they're going to, and the COVID risk exposure at those destinations. So we combined all these factors to calculate this index measure, which categorizes certain parts of Bangladesh to be more at risk than others. So just to give you a very quick example, I hope you'll be able to see this on my screen. Are you?
Yes.
Let's see.
Yes.
So
sort of can be seen. Yeah.
So just I don't think you can see the details really, but I think you can see that some parts are darker than others. So the dark parts are the areas which our index measures as being more at risk compared to like these lighter areas that I was saying that have lower exposure. So the idea and again, like, I won't show you all the details, but we also did a similar analysis, not just for Bangladesh. We did it using data for Philippines, which is another country which is heavily dependent on migrants. And then we also did it for more globally, looking at different countries' exposure risk compared to others. And the reason why we think this is important is because this will help policymakers more globally to direct aids potentially to areas that could be more highly exposed to COVID. But even within Bangladesh, in thinking about how we want to allocate our limited resources in a timely and efficient manner to the areas that are more at risk first before others. And I think we all agree that this measure is perhaps not the perfect measure, and there are probably a lot of issues with this measure. So I think we all agree that that's possible, and we've all been doing this research in a very limited time with the limited amounts of data that we have. So of course we acknowledge that this is not a perfect measure. However, we did try to validate our results using some data that is available. So we do have, for example, numbers of quarantines that have been done in the different districts. And we do find that the risk that we calculated correlates very strongly with those quarantines, which indicates that there is definitely a strong relationship between these two things. Mm-hmm. We also looked at, I think you might have heard that the Bangladesh government has like a 333 number, which is like a hotline number that people can call if they have if they are suspecting that they have COVID or if they have symptoms, right? So we managed to also get some of that data on where these calls were coming from. So we don't have, for people who are worried about privacy, we don't have any details about the actual callers, but we do know how many calls are coming in from what areas.
Just the location,
exactly, just the geolocation, which also enables us to see which parts of the country are showing more distress calls compared to others. And so we also use that as an additional measure to validate the value of our index, and we find again that those two are very strongly correlated, which all of these basically indicate to us that potentially our measure could be a good one for telling us what the high-risk areas are.
All right. So, Miss, if we could sort of move on to the point where that, like, as we all know, the vaccine is going to come it's still a long shot, because minimum 12 to 18 months would probably be taken for actually to have like a vaccine that can be used on human beings, right? Like, it's still being tested. But, while it's being tested, a lot of countries, as you know, is under quarantine, even Bangladesh. And as you said, we don't even know when the migrants can actually go to their countries of work and when we will actually get, the money from there, and as you said. So what do you think are the trade-offs for such developing countries, and how can they address this, given the situation?
So I think you bring up a very important point, which I think for countries, low and middle income countries, which Bangladesh is part of, is extremely important to realize. And I think it is here I would refer to some research that has recently been done, again, by Dr. Mobarak and a co-author, where they look at the different costs and benefits of doing lockdowns and social distancing for high versus low income countries. So I think it's important to realize that the way these lockdowns have been implemented is keeping in mind models such as the Imperial College model, which looks into the costs and benefits for high income countries, because some of the early countries that got affected, while China is not high income necessarily, it's definitely able to implement a lot, and they're a strong economy. And then it hit Italy and Western Europe and then the US. All of these are high income countries. So there are some key differences between demographically and economically and even socioculturally between these countries versus low and middle income countries like ours, which actually make it important to realize that the policy measures we should implement in these two contexts should not be equal and same. So, and I think there is generally very broad consensus amongst economists and policymakers globally, and definitely within each of these countries, that policies should be different. So just to touch upon some of the key differences, we know that firstly, age distributions are different. The virus is definitely has a much higher chance of affecting older age groups more fatally than they would younger age groups. And so if we look at the population age distributions in high versus low income countries like Bangladesh, they look very different. So just from a population age perspective, Bangladesh is at a much lower risk of having more serious and more fatal COVID cases relative to countries like UK or Norway or so on. Now, we should acknowledge, of course, that even though we have a younger population, we have other underlying comorbidities, for example, high pollution and lung-related diseases like pneumonia and tuberculosis. So we do need to keep that in mind, but those considerations aside, just simply from an age perspective, we are at lower risk. And then secondly, there's also the labor market constitutions and how they're composed. So if you look towards the West, the majority of the workforce works in the formal sector. Comparatively, if you look at ours, I think it was estimated that roughly 20 million workers will be affected. Over 87% of the workforce is in the informal sector in Bangladesh, and that's roughly 20 million workers who will be affected by these lockdowns. And these, when I say informal sector, of course, I mean, the rickshaw pullers or the people who are on daily wage, the construction workers, the street vendors. And I think one of the examples I just recently saw of this, and this brings with it other risks. So, you had street vendors selling PPE on the side of the street. And I think they have to resort to these measures because they're no longer able to do the things that actually earn them their daily wage. So I think having people in the informal sector is a major difference in between us. And the reason why it's significant is because when you have workers in the formal sector, when there are things like lockdowns, the government or either the state or the employers themselves are able to provide these workers with benefits like unemployment. Let's not talk about the US here because the US has a lot of problems in this area, but generally, at least in the case of Western Europe, as has been the case, the social safety net is very strong. However, when you have the same labor force, but in the informal sector, you're no longer able to support these workers through these kind of unemployment benefits and social insurance transfer schemes that would be possible in other countries. And then finally, just from a cultural perspective, we have a lot of joint families. We have we live in joint family homes. We have high population density, which just makes the process of social distancing a lot more difficult. So in light of these, we have, just to go back to your earlier question, we see examples in countries like Singapore and Malaysia, which obviously have much more developed than Bangladesh, that have been allowing their businesses and factories to continue to operate while they are strictly monitoring the spread of the disease. Now, I think a closer example to look at for us is Indonesia. So Indonesia is has been trying to copy the Singapore-Malaysia model. However, their population density is significantly more, and they're much less developed, much like Bangladesh is. And so for them, it has been a much bigger struggle in order to figure out the right balance between keeping the economies open while also limiting the spread of the disease. So I think we should be watching countries like Indonesia closely to see how they're able to implement this. But while this is happening, I think we should turn our attention to a couple of other areas. So I think it's widely accepted that the key to getting out of lockdown and reopening our economies at this point is improving and doing wide range, extensive testing. As we established before, that opportunity for us is much more limited, and being able to ramp up testing in a short period of time will be difficult. So in the absence of testing, what are the alternatives that we can do as a low-income country that can enable us to slowly have to continue to operate while limiting widespread COVID around the country? So I will mention some of the so I can mention some of the strategies that have been thought of by Dr. Mobarak and Dr. Abu Shantroy and other researchers who are currently working on some of these approaches, because I think it's good to know what some of these practical approaches have been. So I think some clear low-hanging fruits are understanding having better hygiene practices and having or wearing masks on a regular basis, even though the evidence there have been still growing on how helpful these are. But I think especially on hand washing, I think the evidence is clear that repeated hand washing does actually help prevent the spread of the disease. So in having better implementation of this, we need to have better messaging around the country in how to wear masks appropriately, how to wash hands appropriately, in order to be able to limit the spread of the disease. And here, I think we, as Bangladesh, definitely has a strong advantage in some ways. We have a large network of NGOs. I mean, BRAC is only just probably like the biggest one, but even outside of BRAC, we have a large network of other NGOs, and through this network, we can actually probably reach almost all of Bangladesh. And so what is kind of messaging that we need to do? We need to talk about how to better hand wash, how to reduce local congregations and limit our social interaction. So I know this is Ramadan, and you know there is a practice of Tarawih every night, but those kind of practices are at risk of spreading the disease further. And this is why even if we look towards Saudi Arabia, we've seen that Hajj has been,
voted for now, actually.
Exactly. So I think this is, and you know, the importance of hygiene is also, at least in almost all religions, definitely in Islam, like is highly prioritized. So I think in order to spread these messages, it is important to look towards community leaders who are well respected in societies, in these communities, and this could include, the local UB chairman and members, imams of the mosques, headmasters, and school teachers, and using them to help spread the message further. And of course, in order to do that, one of the things that we can do is find ways to incentivize these community leaders to spread the message by giving them a small mobile cash transfer or other incentives, so that they actually help spread this word. So there is currently some work being done in this area by the researchers I mentioned earlier. So the second thing that's extremely important to support, like I said, a lot of the informal wage workers in Bangladesh, is to find ways to disperse social protection transfers quickly and immediately. And I think here we know that the government has already declared to increase the BJT and VGF, and that should be done at most.
Mahreen, after a lot of technical issues, we actually got you back. So that's fantastic. And to all the viewers, we're extremely sorry for whatever technical issue that we were actually facing, but now we will be answering all the pressing questions. And we'll also, don't worry, we will also be going back to the questions that were posted in the last live stream video. So don't worry about that. So Ms. Mahreen, if we can take back from what you were saying, you were talking about the RMG workers and the government's initiatives. So let's catch up on that.
Right. So I think just going back quickly about having some clear messaging around how the promised bailout is actually going to help the workers is the type of key leadership necessary at this point in time to help put people at ease about the situation. A recent survey actually in Nepal really showed that for people around this time, their main concerns are not really actually about the health issues around COVID, but it is really about employment and food security, because those are, and I, while the survey is in Nepal and not Bangladesh, I would imagine if we would look into the findings of surveys here, we would find very similar results. And I think the recent protests in the RMG sector is very much a manifestation of that kind of concern in the majority of our population. So, and I think now going back to what I was saying earlier about safety nets. So we already have the BJT and VGF, and while the government has declared that this will be expanded, I think we need to understand how and when they will be expanded, and they should be done with as much as fast as possible, I think, at this point in time. So we need to get money to the hands of the poor. And I think there was a recent television interview with Dr. Abhijit Banerjee, Dr. Mushfiq Mobarak, and Asif Saleh at BRAC. And essentially, it was the same messaging that we received from them as well, that we need to get money to the hands of the people as soon as possible. And here, what can we do to actually facilitate this process? So we know that one of the traditional ways of doing that is usually through our local UP networks in terms of listing people who are most vulnerable and finding and identifying people like that. However, due to the concerns around social distancing and also the time needed to do this kind of listing process, we know that we may not have that leisure of time in our hands. Additionally, that kind of listing process brings together many concerns around corruption and leakages that I think also viewers in your community will also be aware of and concerned about. And rightly so. I think given our history of corruption in Bangladesh, that is something we very much need to be aware of. So we need to how can we make sure that we are getting money to the right people who need it? Here, I think there is a huge role to be played for using technology to our benefit. Bangladesh is one of the developing countries which has one of the biggest outreaches of mobile phone communication, and most people in even the most isolated parts of Bangladesh have some type of access to mobile phone communication. So this is actually something that we really can use to our advantage. And in fact, Dr. Mobarak is actually trying to do something with the mobile phone companies along in this area in particular. So the way data can be used is, mobile data can be used is the following. So you can imagine that somebody who has who's using a mobile phone and is the day wage laborer may have very different patterns of using their phone, whether it is to transfer money through bKash or otherwise, or whether it is in the number of calls they make to the areas where they make their calls, that pattern might be very different from people who are in the cities and upper or middle class families who are using their phone and technology. So using this variation in how people use their phone is one interesting way that people have proposed, researchers have proposed, that you can use to identify populations that are more vulnerable. And this type of using this type of technology and data can be done much faster than trying to do some type of listing or census process in order to identify vulnerable populations. So what's key to doing this is actually having the right level of collaboration with our mobile network companies so that they can share their data that would enable computational researchers who are able to then work out algorithms that help identify these populations. I think the second concern anybody would have with this type of methodology is, are these algorithms actually identifying the right kinds of people? The group that's working, Dr. Mobarak's group who's working on this, they also have additional data from their own surveys that they've actually done in different parts of Bangladesh, where they have collected more extensive information on populations, their poverty levels, and their levels of food insecurity. So what they can do is match data that they match the people identified through the algorithm, and then match it with the data that they have in these regions and see if they actually coincide. So this will help them actually understand if that type of algorithm is actually helping identify the right sets of people who should be eligible for getting money. And even one thing that's important to keep in mind here is even if we are identifying a larger group of people who are for this type of transfer, then so if you're saying some people are more vulnerable than they originally are, I think in the case of Bangladesh, that is not a problem, because those, even if they are not the most vulnerable, even if they are slightly vulnerable, they could still probably use that additional money. So we are actually not going to be doing much harm in that regard. So I think most important, I guess, in this is having speed in getting that money to the hands of the people.
All right, understandable. So I think because you mentioned corruption, when you're talking about distributing the money to the people who are actually needing of those kind of money. So in case of corruption that we know is already very rampant within various government offices in our country. So in that case, what do you think could be the alternative? Like, what could be done? Could there be a hand of organizations or NGOs who work for labor rights or for giving labor their money or anything of that sort during this time? So what do you think about that?
So I think there are some examples that where in other countries, like I think in India, you have the Aadhaar card, which gives people like also a mobile account access, so you can make direct transfers to their account. So I think we should definitely, again, going back to collaborating with mobile companies or companies like Bikash or other. I'm forgetting the other.
Or Rocket, yeah.
I think while I think it would be potentially unrealistic given our setting to think that there will be no leakage at all from these type of transfers, admitting that there will be possibly some leakage, I think we can still aim to improve the process by going directly through channels like transferring the money directly to the identified population. So instead of money changing hands, so that it has the additional risk, as we know that having people to come and queue up for receiving money that has received a lot of bad press in some other contexts, where in India as well, where people were queuing up and crowding around to try to get either rations or their money first. I think this type of direct transfer eliminates both the risk of spreading the disease while also mitigating some of the corruption risk. And again, like I said before, I think assuming we will have zero leakage is probably an unrealistic expectation in our context. But I think mitigating that and reducing that to the extent that we can is should be the goal.
All right. So I think one of the last topics that we'll have to discuss is, because of the shortage of time, we'll have to cut down a lot of discussion. But one of the discussions that we should be talking about is, how when Wuhan was affected initially for the COVID-19 and, the spread started and China was under a lockdown, there was this entire, as we call it, the world's factory, it's sort of stopped. And, for that, I think a lot of other countries who are actually involved economically with China were affected as well. So in that case, like, how do you think like the global supply chain can be, changed for the future if there is any sort of pandemic like this in the future, if it ever were to happen?
Right. I think that is an important question, and I think it's a question that's actually being debated and discussed in all the highest levels in the world. I was recently listening to a discussion that was organized by the Center for Global Development with the International Rescue Committee, talking very much about this process of connectivity. I think just the spread of the disease itself shows the degree of connectivity we have in this world right now, which is, like in previous outbreaks like the SARS, which was in the early 2000s, the level of connectivity we had was definitely not to the same degree as we have now. And so I think that's definitely one of the big things to be aware of, is, whether it's connectivity in terms of just movements and people, in terms of work and supply chains. I think it's difficult from an economic perspective, for countries to be completely self-sustaining. Imagine if you would bring it down to the very micro scale. Imagine, could we as individuals, grow all the food that we eat and survive on our own? I think it's very difficult to then extend that same analogy and think of it either in terms of the countries or the world. So what are things that will probably, I think we can expect that will change in the post-COVID period, if that might happen? So I think some things that have been discussed are, one is in terms of working, it's having having more integration of technology so work can be more seamless across borders. So while this doesn't still solve the problem of actually sending materials to different places, I think that process still has to be done through physical means. But a lot of the work can be done globally, as we have all realized, like, here I am sitting in Boston, talking to you here in Dhaka. And I know we had a lot of technical issues, but despite that, it's still possible. And I think this crisis has made us realize, and like I said earlier in my at the start of my talk, I think this has made us realize that a lot of the mental barriers and even the physical barriers we might have had in terms of working across the geospatial boundaries has been minimized or at least mitigated. Technologies are now being developed, like the one that we're using, for example, or Zoom. All these technologies have improved significantly in a very short period of time, allowing people to work across borders much more seamlessly. So that's one aspect of the work itself. But the second aspect is also just thinking about public health in a more integrated global way than we have in the past. So right now, despite the WHO issuing their various warnings and so on, each country, and even within each country, if you look at Germany, if you look at the US, which is, an set of states working together, there is a lot of independence, and within Europe, each country is responding differently. So that means that there has not really been an integrated response to this world crisis. And I think that's, while it's difficult from a nationalistic perspective, I think this is an important time for organizations like the WHO and the UN more broadly to think about if that is something that people should be working towards. And I think one aspect that we haven't touched upon, but I think the issue of supply chains and thinking about global production makes us realize is this issue of sustainability and from an environmental perspective. I think the world has struggled globally in terms of reducing emissions, reducing our carbon footprint. And I think what this crisis has also made us potentially realize is how can we start producing in a more sustainable manner. And I think we need to exploit all the things we have learned during this crisis, where we have had to limit, the amount we travel, the amount we produce, to live in and produce in a more sustainable manner. And I think that's something that we definitely need to take forward as we start recovering eventually from this crisis.
Mm-hmm. Okay, so I think we'll take one of the questions that was posed in the last live stream. I think it was Mr. Lilin Rahman. He asked about how, the economic dynamics might change in the future after this pandemic. So what do you think, according to you, what kind of changes are we sort of expecting after, the lockdown ends or after the pandemic is sort of controlled? What do you think the economic changes we'll be seeing?
So I think I was just talking a little bit about that earlier in the last question. So I think just to repeat some of those, I do think there will be, firstly, I think it's important to mention here that I think the way out of this lockdown is still very long ways away.
True.
And I think, like we talked about before, even I think it's important to keep in mind that while a vaccine may be produced in 12 to 18 months, it's very different from the vaccine being successful in a lab in Oxford University versus the vaccine being available to Rajshahi,
mass people around the world, right?
Like any other random parts of the world. So these are two very different things. And I think if we want to actually think about that more realistically, that's actually going to not just take 12 to 18 months, it's probably going to take much longer than that. While that's not being done and without having adequate treatments of the disease, I think there will continue to be spikes and flattening of the curve as in the next couple of years. So during this time, I think we need to figure out how the economies will adapt. And we talked about a lot of those in how we should think about adapting our economic production. I think along with that, I'll just reiterate what I said previously. I think the move towards how do we have more integrated work systems so that we can work more seamlessly without being there in person. So while a lot of production does need to happen in person, a lot of work, especially around management, can actually be done remotely, and having that, developing better organizational and work practices that enable us to do that kind of work is I think we're having to develop out of the urgency, but hopefully that's something that will continue to be carried forward even when potentially we are over this. And then secondly, I think the world thinking more globally about public health crisis and thinking of more integrated and coordinated responses, as well as because I think it's clear that even if China is impacted or even if Bangladesh is impacted, that affects what consumers can get in the US or in the UK. So I think that kind of those kind of links, which I think were made clear during the last financial crisis, has become even more strong and obvious to us right now. So I think that hopefully there will be some policy response in that direction. And again, like I said before, I hope that we will have much more sustainable practices overall in terms of economic practices.
Okay, I am absolutely understanding. Thank you so much for giving us your time, Ms. Mahreen. Apart from, despite the technical issues, It was a lovely discussion with you, and I really hope that all the people who are actually watching this live stream actually get some kind of an idea what we are going to be facing or how we should prepare. So thank you very much for your time, Ms. Mahreen. It was an absolute honor.
For bearing through all those fun technical problems. Hopefully some of the audiences still managed to keep their patience.
Yeah, I really hope so too. And thank you to all the viewers who actually watched all the 3 episodes of EiFAC, Exchanging Ideas for a Change, which was brought to you by BUP Global Affairs Council. Thank you so much and have a very good night. We'll probably see you soon. And well, good night and have a very good day, Ms. Mahreen.
Thank you and stay safe.
Stay safe.